Well, from new cases to those who are still recovering, survivors who call themselves long haulers still suffer from the symptoms of coronavirus, and there's really little experts can do to treat them. CBS 12's Lily Ortiz sits down with one woman who's raising awareness, hoping her story leads to a possible cure.
Bischoff got sick with COVID-19 back in March, early on in this pandemic. Now she's not even close to feeling like her old self. Things like climbing a flight of stairs can put her back in bed for days. Karen Bischoff was a healthy firefighter paramedic. She experienced symptoms like shakes, high fever, cough, and shortness of breath after her coronavirus diagnosis back in March. But her life has not returned to normal. Even after tests show the virus is out of her body.
If I stand up for 3 to 5 minutes, I'm going to pass out. So how do I go to work and take care of my son as a single mom?
The World Health Organization says 10% of COVID-19 patients, or hundreds of thousands in the U.S. alone, may fall into the long haulers category and could experience new symptoms like fatigue, heart abnormalities, and brain fog. For Bishop, it's affecting her livelihood. Even simple chores around the house is not an option, and it's affecting her physical and mental health.
I'm very grateful that my son is super self-sufficient, and he's very smart, and he's very helpful. He'll help me clean the house. He'll help me with the laundry.
Doctors have since given her a new diagnosis, but there is little they can do for treatment.
Dysautonomia, which is dysfunction of the autonomic nervous system. Everything that your body does automatically is not functioning properly. So your heart rate, your blood pressure, your breathing, your digestion, all of those things are being affected.
She created a group online to start a conversation. It's a safe place where survivors with lingering symptoms can share their experiences and search for possible solutions.
We kind of are the forgotten bunch. I was blown away by the amount of other people still suffering with COVID for months.
She has since participated in various studies to keep her group informed about the work that is being done to bring them back feeling 100%. But Bischoff says more needs to be done.
What we're really pushing for is comprehensive post-COVID care centers. You would see all your doctors, you would have all of your tests, and they would basically plan together to try and figure out what they can do for you.
I'm Lily Ortiz, CBS 12 News.